Howdy. I'm going to do a dressing change on a wound on a patient who has a leg, has an incision in the leg that dehisced and is now open and separated. So I'm going to have my supplies, which are going to be sterile gloves, which I have in my sterile container, which also contains 4 by 4 gauze, ABD pad. It also came with saline. I'm going to be a makeshift syringe. There's tape and sterile applicators and a measuring guide for the wound and a pen. So what I'm going to do is first introduce myself. My name is Brenda Lynn. I'm going to be a student nurse today. I'm going to identify the patient. I'm going to ask for Miss Smith's name and her birthday to prove that it is her. I'm also going to do a pain assessment as well as check if she has any allergies. I'm then going to provide privacy, and I have all my supplies on a clean surface, and I'm going to inform the patient of what I'm going to do. So I'm going to tell her that I'm going to take off the dressing that she has on, clean, and replace it with a new one. I'm going to tell her why I need to do that so that we can prevent complications and promote healing. I will answer any other questions she has, and I will then ask for consent. Once she says that I can do her dressing change, I will then raise the bed to a comfortable working height. I will perform hand hygiene and prepare my supplies. So I'll put my clean gloves on. I don't have clean gloves, so we're going to pretend here. And then you're going to take the tape off and pull towards the wound on both sides. Make sure that they're all done. And then I will pull from the top to the bottom. There's packing in there, and I will assess. I'll have to take that out so we can use an applicator, sterile applicator, or your hands. Of course, I still have gloves on. And I will take out the packing. So there's one. And there's 2. Okay, so then we'll observe the bandage and the wound, so we can tell the wound has a little bit of drainage. It's pink, what is that, serosanguineous fluid, so it's light pink, which is just a mixture of blood and serous fluid. I'm also going to observe the wound and notice if there's any eschar, slough, tunneling, or undermining. And now that I don't notice that, I'm going to continue on with what I'm going to do. I'm going to take the dressing. I would have clean gloves on, place it in the glove, take it off, pull it off, and dispose of it before we go on. This is my bag for trash. Okay, probably not the best spot, but whatever. We're gonna have our trash right there. I'll perform hand hygiene, and then I'm going to go ahead and measure the wound. So I'll use another sterile applicator. I will measure the length just by holding it up, so that, and I'll come over here, and that's about 3 inches. Then I'll do the width. That's 1 inch. I will discard of this one, and then I will do the depth, put all the way in and measure. And that one's again about a 1 inch. So I'll write down my measurements somewhere and so that I can document them later. I will then, after all that is measured, I will remove my gloves, perform hand hygiene again, and then I will set up my sterile field. First, I'm going to go ahead and put a clean pad underneath my patient for when I do cleaning, just so that we can protect the intact skin. So, washed hands, blah, 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 and now I'm going to open my sterile field. So, I'll open it away to the sides, this ratty thing. This is, yeah, and then towards me, and open it up. So in here, I just put in there myself some sterile tweezers, so I'll take out my gloves and this thing. Oh, so that didn't go everywhere, but that's okay. It's still sterile. Doesn't matter. Okay, and I'm going to place this right on the edge. The inch border from where I touched is on the non-sterile side, and the rest is on the inside. Okay, and anything that's hanging off the table is also considered non-sterile. So I'm going to go ahead and open my gloves. Oop, wrong way. I guess I will just put them on. Got it. I'm actually going to put this over here. That's sterile. I didn't touch that. It's cool. I'm going to put my gloves on my, what is it, my non-dominant hand. Yeah. Also, before this, I would have put my face mask on and my gown to protect myself. I will then unscrew my saline. I'm not going to use this one because it's still not open and I don't want to waste it. So I would fill up a syringe with 35 to 60 milliliters of saline solution, and I would keep it in there, but this is my saline solution. So that's finished. I will go ahead and, I guess I can take that out now. Hold on 1 second. When I would open this, I would make sure that I write my name on it, and well, I date it, not write my name on it. And it has a 24-hour time frame. And when you pour it, you want to pour away from the label. So here, cool, syringe, whatever, if that happens. And then what do I do? I'm so sorry. Okay. And now I will put on both my gloves. Now that that is ready. Okay, that is ready. So, it's still in there. This is my sterile container. I'm going to take out 2 pads for the cleaning, then 2 pads for the dressing change. And we'll leave 2 in there for the wet part. We got the applicator tips, sterile, and then the ABD pad. I know my sterile field is funny. Open this up. Okay, with the syringe, I would irrigate the wound. So here, and I would clean it until the fluid that comes out is clear. I will then take one and pat dry down and get rid of the gauze. I'll do another one, pat down and get rid of it. I think that's how we do it. All right, here's what it is. Then we're gonna go in and put a little bit of water on, a little bit of saline on our stuff. And then we'll put it together. That'll be great. Be good. Make sure that's wet enough. And then you'll pull it apart. You're going to open it up and fluff. You can do this. Gosh. I can't open it up. There we go. And one more time. I feel like it should open more. Okay, there we go. You're going to wrap it around the fingers or fold it, however you want. And then fold it up as an accordion style. And since I took out two packing, I'm going to put 2 in. So we're going to start at the top, trying not to touch the intact skin because we don't want the intact skin to become wet because that can cause breakdown. We're packing it in. All right, that's one. Dispose of that one, and we'll open up the second. Wrap it, fold it, or make it into a tube. Accordion style. Second applicator. Again. Now we have our dry dressing. We can open that one up. We're going to fold that one again. And that one will be placed. We want the fold down so that it doesn't rub or anything, and place it. It stays wherever it was dropped. You cannot move it. We'll do that one again. Oop. Fold and drop. Okay. Okay, and now we'll do the ABD pad. So there's a blue line on this pad, and that remains up when you go on the wound. So we'll pinch it and open it up that way. And then that just goes flat on the wound. And that is the end of our sterile portion. So I will take my gloves off, turn them inside out, so on and so forth. I'm not going to remove these. Are still fine. I'll fold these back up. Now we're going to go into the taping. Actually, let me get rid of this. I still have gloves on. Now I've taken my gloves off. Okay, with taping, you don't want to do too much tape. Measure. You get the table too. Okay, and we'll do the top. We don't want to occlude the top. And then with the bottom, you will close off the bottom. Okay, I'm going to get a second piece of tape. I'll initial, so BB, what's today's date?
The 18th, 3/18/20.
Oh, we'll just do 3, I'm about to write mine. 3/18, and we'll do 5 p.m. Like that, and that'll be right on top. Okay, well that completes the end of our dressing change. I would then lower Miss Smith's bed to the floor. I would give her her call light, provide her with any comfort measures she needs, and answer any questions that she may have developed throughout the procedure. But that's it.